Thank you, David. Next, please. You'll need to state your name because I have a long list here and I can't remember
okay.
who I called.
Good morning, I'm Laura Scurry. I'm with
Okay.
the Mental Health Providers
Laura,
Association.
thank you. Welcome.
I had a speech written, but the Optum thing just blew it, so we're going to talk. I've been speaking to this body since 2000. Every year I come to you and I share with you what's going on, what the impacts of the changes that we're negotiating are, and I've seen this body perform small miracles. I've been working in behavioral health care since 1993. I've seen the pendulum of treatment come and I've seen it go. We're faced with an opportunity with the entrance of managed care. It's not going to go away. It is the solution to how we're going to deliver healthcare services in the U.S. We get that. You get that. We're all on that same team. However, this body is charged with and has the opportunity, which is a rare opportunity in the United States, to manage the implementation of Optum. Idaho is one of the very few states in the United States that the legislative body controls the implementation of behavioral health services, and we appreciate that. As a member of the Mental Health Providers Association for all these years, you guys, many of you have seen me, heard me. I've been pregnant a couple times. We've been through it all together. But I want you guys to please understand, you know the problems. My company this week, we're in over 80 hours of hold time, 80 hours. And that's just me, one region. I have 2 companies. The other company's just as bad. This isn't working. What we need to do, and what I need you to direct Optum and the department to do, is to work with the provider associations and the private providers. We're not greedy. We've proved that to you over the years. We understand what a unique opportunity we have to maximize the funding that we have available. We're 50th on funding, but nobody's ever come in and said, what's your impact? What's your efficacy? We're pretty good. We have our issues. We're always going to have our issues, but we're pretty good. And we have a unique system within Idaho and the opportunity to develop an even uniquer system within Idaho. Let's take that opportunity. I need you to direct Optum and the department to work with the provider associations and the private providers. We understand that we have a special population. We don't serve the typical mental health populations throughout the United States. We've carved our population into a specific group of people that we serve. Those individuals have specific and unique requirements. We can take this opportunity to develop a system of care that is cost-effective, treatment-effective, and preventative. If we will take the time to talk, to evaluate what we have, and to remedy the problems that we have. The system that we're using right now will be catastrophic in the near future for providers and participants, and that's what we're trying to prevent. Thank you for your time.
Thank you, Laura, and we are aware and we are working with Optum. We
you.
appreciate that. Thank you so much. Sarah Lloyd. Susan Jameson. Genevieve Sylvia. Sarah.
Chairman Hyder, committee, my name is Sarah Lloyd, and I'm an owner of a service coordination agency here in Ada County and Canyon County. And we represent about 165 individuals with developmental disabilities, and I'm here to support the change in the wording for, to allow the budget modifications for individuals, not just for health and safety, but also for employment needs. I would say about 15% of my clientele are choosing not to access community-supported employment to have jobs in order to maintain their 24-hour support within their home. Kind of unfortunately, what a group of these people are very high-functioning, but their behaviors, they need that 24-hour support. I've had one client in particular who chose to access the CSE, but in order to do that, even though he qualified for 24-hour support, he had to drop down to an hourly support and only get 6 hours in his home a day of support, plus his CSE. Unfortunately, during those nighttime hours, he ended up getting himself in trouble, and now he's in the prison system. So if he doesn't have, and some of these clients, if they, I mean, working is, keeps you busy, keeps, you know, it's help contributing to society. And if he wasn't working too, because that was the flip side on some of these others that aren't accessing because, you know, needing the 24-hour support is they get bored and then they just get in and cause more problems and have more behavioral issues. And if we want to get them off of the system, we want to try to teach them how to function in society. And so if we can work by changing that wording and getting some of these individuals working, then hopefully, and also if they're working, then they're coming off of food stamps and some other assistance. So that is all I have. Thank you.
Thank you for coming, Sarah. Suzanne?
Mr. Chairman, members of both the House and Senate Welfare Committees, my name is Suzanne Jamison, and I'm the Executive Director of the Idaho Dental Hygienists Association. I come before you today to urge you to consider the creation of an oral access advisory task force to evaluate the existing and potential workforce models of providing dental care in Idaho and assess the benefits that other states have found in expanding the scope of dental hygiene practice. As things stand today, the dental hygienist is one of the most underutilized professionals in the state of Idaho. Other states have found that increasing the responsibilities of hygienists has resulted in increased efficiencies, improved access to dental care, and lowered costs to patients. We would hope such a task force would address many of the deficiencies in dental health in Idaho. For instance, did you know that 2/3 of Idaho kids have a cavity by the 3rd grade, and half of those will go untreated? Most of Idaho is designated as a dental health professional shortage area. That doesn't mean there's a shortage of dentists in all areas. It just means that most practices tend to congregate in populated areas, and other areas go unserved. Almost half of Idaho adults have no dental insurance, and an estimated 70,000 Idaho kids are without dental insurance. 3% of Idaho kids have dental-related pain or infection right now and need urgent care. And among Idaho adults 65 and older, 1 in 4 has lost all of their teeth. Idaho is in an oral health care crisis, but there is an answer. There are currently more than 1,000 licensed dental hygienists in Idaho who can help provide Idahoans with better oral health through education and prevention if we are utilized fully. Those hygienists graduate from accredited programs with 2,000 hours of curriculum, 500 to 800 hours of supervised patient care, and 2 to 4 years of course study. They have to pass a regional clinical exam and written boards, and those hygienists are qualified to deliver oral health care safely and effectively without supervision. The Oral Health Plan of 2010 through 2015 states, quote, "People in Idaho experience challenges obtaining access to preventive and restorative oral health care. It's important for Idaho to investigate and discuss new workforce models and fully utilize the skills and demonstrated competencies of the current workforce," unquote. While the Idaho Dental Hygienists Association supports others who are calling for restoration of non-emergency dental coverage under Medicaid to Idaho adults, we also urge you to consider that existing and potential future money could be more effectively spent by expanding the usage of one of Idaho's most underutilized resources, the dental hygienist. Thank you.
Thank you very much, Suzanne. Genevieve?
Hi, I'm Genevieve Sylvia, and I'm 19 years old, and I live in Orofino, Idaho. For the past 2 years, I've been in and out of the doctor's office and emergency rooms trying to find answers for my kidney problems. In November 2013, they finally started to find what's wrong with me. They said that I have sponge kidney disease, I have hypercalcemia, and stones in my appendix. After we finally started to find answers in December, my Medicaid got cut off, so I am no longer with answers. I work as much as I possibly can right now, and I do not qualify for Obamacare. I don't make enough. All I'm asking for is a little bit of help. There's no way I can do anything else. I'm trying my hardest. And another thing is my mom. She's never had insurance, and she means everything to me, and I don't want to lose my mom just because she can't get insurance. And that's it. Thank you.
Thank you, Genevieve. We appreciate your coming today. Is it Tana Lynn Kessler, Amy James Risch, Misty Dawn James, Stacy Stevens. Jana Lynn, thank you for coming today.
You. I'm really new to this. I've never been to a hearing like this before. I come as a parent of 6 adopted children. They were siblings. They became part of our family. It'll be 6 years ago this March. All siblings, and health and welfare needed a home to take all 6 of them. And the youngest of my biological 6 children was a senior in high school, and we decided to go ahead and do that. And so we have 2 little families. Now we have the younger 6. They all have mental health issues. Their parents, aunts and uncles and grandparents all have multiple mental health diagnoses. And we have, over the years, tried to sort out what is genetic, what's environmental, what had to do with early childhood trauma. There was a lot of trauma and a lot of abuse and neglect in these children's lives. We have counselors and PSR services, and we go to a pediatric psychiatrist who does our med management. And he is probably the key that makes it all work. All the other services are very helpful, but without the medications, it's hard for the kids to take advantage of the other things. This doctor that we have been seeing for several years is being forced out. He's not going to be able to be a provider under Optum because Optum requires that he have office hours 4 days a week and that he digitize all of his records. He's an older man. He works, he's semi-retired, and he only works 2 days a week. And he really cannot afford the cost of the software to do the digitizing that they want to do. And so we're going to lose a fabulous provider who has great compassion, who knows my 6 children and me and our needs. We have files this thick. All that can get transferred to some other provider. Looks like we'll end up with a nurse practitioner somewhere. This man has 40, 50 years of experience. I don't understand why, when we're so short on good providers, we would make these kinds of rules that force the best providers out of the field.
Thank you, Jana Lynn. We appreciate your testimony today.